So what are the symptoms if a person thinks they might be having a heart attack or an ischemic attack? What are the symptoms for women and how do they differ for men?
Right. Well, you know, the most common symptom in women and in men is chest discomfort. And this can be experienced as a pressure or a squeezing or a burning sensation in the middle of the chest that lasts for more than a few minutes or that comes and goes. And that tends to be the most common presentation, but women, much more so than in men, tend to have atypical symptoms. So they may have pain in upper parts of the body apart from the chest, and that would include the jaw, the neck, the back, and the shoulders, and women can even have stomach pain. In addition to that, women might experience nausea or dizziness, or they might break into a cold sweat.
Mm-hmm.
One of the symptoms that has emerged as particularly remarkable is unusual fatigue. And by that I mean you're exhausted just making the bed. The other symptom that's noteworthy is just, anxiety. Now I know we're all anxious, we all have stress in our lives, but it's part of, I think that if a woman finds that she is markedly fatigued, and this is something that represents a real change in her pattern. For example, in a commonplace activity like making the bed,
mm-hmm.
she just can't complete the task.
Mm-hmm.
And I think that that may be what we call a prodromal symptom. And I think we need more research to identify which are those prodromal symptoms in women, mm-hmm. so that women can be aware of those symptoms and seek help sooner rather than later. And by that I mean calling 911 and getting into the emergency room.
Mm-hmm. If you're thinking you're having a heart attack, is it a good idea to take an aspirin? You still recommend that?
You can take a baby aspirin. The best thing to do if you think you're having symptoms of a heart attack, the most important thing to do is to call 911.